My name is Nunki Hassan. I'm a postdoctoral research fellow in Cancer Stem Cell Laboratory based at the University of Sydney. My research involves leukemic stem cells in acute myeloid leukemia, and essentially acute myeloid leukemia is one of the deadliest blood cancers compared to many other types of leukemias. In the last 40 years, there hasn't been any marked improvements in the therapies for this type of blood cancer, and it hasn't changed the patient survival compared to other types of leukemias which had new and novel treatments. And the reason is because there's these leukemic stem cells, or a type of tumor cell that is highly resistant to therapies and is causing the disease relapse in patients. And so our group is trying to focus on understanding the biology of these leukemic stem cells and how to target them and find a new therapy and eradicate the leukemic stem cells and provide a cure for this aggressive type of blood cancer. So what's innovating about our research is that we found this particular mechanism that is critical for the survival of these leukemic stem cells, and essentially we have found a way to inhibit it. And this particular mechanism is only in leukemic stem cells and not in normal healthy stem cells, and therefore it's a really good target. And so by inhibiting this particular mechanism in leukemic stem cells, we can essentially eradicate the leukemia in patients and achieve a positive response. I did my PhD on adrenal cortical carcinoma and looking into finding different therapies and to target a rare type of cancer. And a lot of the cancers that are resistant and have shown to relapse in patients are cancers that have these dormant cells, which have these stem cell-like properties. That really interested me into pursuing leukemic stem cells. I loved science since I was a kid, and I'd always test different hypotheses and see if it fails or if the hypothesis is accepted. That led me into doing a science degree and eventually into pursuing a PhD and studying cancer research, because cancer is actually one of the most fascinating diseases, compared to many other different diseases. It's one of the leading killers, especially in Australia. One of my biggest achievements would be actually finding this particular mechanism in these leukemic stem cells and testing it in clinically relevant experimental models, and seeing that in these particular animal models, you can see when we create the cancer and recapitulate it in the mice, we can see that when we use this particular therapy, it actually works, this particular immunotherapy. And so I think that is one of my greatest achievements, because now we have a collaboration with the industry partners to take it into clinical trials as well. Of course, finding the cure for cancer, and for me in the next 5 years, 10 years, to establish lifelong, strong collaborative efforts in finding new therapies for cancers. It allows me to conduct my research, find a deeper understanding, and find different innovative ways to address the community's needs and raise awareness and make an impact on humanity, essentially, and allows me to break that glass ceiling and explore and go beyond.